My name is Lillian McDermott, and I'm the host of the Lillian McDermott radio show. And if I were to tell you that I'm going to introduce you to someone who is a world renowned author, as well as an MD, JD, so a board certified cardiologist, a board certified, bar certified attorney, and is a leading toxicity expert, you would think that I would be bringing a lot of different people in front of you. But I am going to introduce you to the one and only Dr. Thomas Levy. And so I'm excited because we're going to have a conversation today about fluoride and his passion and his awareness of what fluoride can do to the body. So thank you, Dr. Levy, for sharing your time today.
Sure. Happy to be here, Lily.
So share a little bit about your background and what interested you in fluoride in the water.
Well, I first started reading about it some 30 years ago, just in the course of going through different information, and I became riveted by the clear-cut scientific data as to how toxic it was and the fact that it was still being put into the water supply. And so while it wasn't my primary focus, I paid attention to that over the years. And then I'm not exactly sure what the year was, probably in the early 1990s, Colorado Springs, where I lived, Colorado, uh, the city council wanted to fluoridate the water, and they had already bought the fluoridation equipment.
Mm.
So it's like already $1 million investment for city council in the city. And I can't even remember all the details. We got a group together of myself and I don't know if there are any other docs, maybe one or two, but mostly motivated, well-educated lay people. And we went through the meetings, we talked to city council, we went through the whole thing. And to make a long story short, I mean, wonder of wonders, we prevailed, and they did, they never, I don't think to this day have fluoridated Colorado Springs. Well, the thing about it is number one is fluoride is toxic. In any dose, it's toxic. And we could go through a lot of papers and everything else, but I can tell you that fluoridation at any level does not decrease dental cavities, dental caries. It does reliably cause a cosmetic and physical breaking down of the tooth called dental fluorosis the higher and higher you get. Now, there's a lot of communities in the country and around the world that have naturally occurring levels of fluoride in the water. In many of these areas, even if you buy into the fact that some fluoride is good, so I'm not going to try to argue that out with people. Okay, and they pick a number, I think, could be wrong. It's like 2 parts per million. That's considered to be a good level, with the acknowledgement already that larger amounts of fluoride do cause this condition called dental fluorosis. Well, they're all for fluoridating, even when, and this was the case with Colorado Springs, even when the natural level of fluoride was already at the supposed target level.
Mm.
Then you combine that with the fact that every community has identified in it babies and young adults who are already having toxicity problems, who, if you fluoridate the water, they need to go buy separate pure water. So it's all part of the concept that you should never medicate 100% of a community with anything. You should leave it to the doctors and their patients to decide what condition this person has. Is it aggravated by substance X, Y, or Z? And if for some reason, I wouldn't do it, the doctor feels your child needs fluoride, you have fluoride tablets you can prescribe. Okay. You don't need to give something to 100% of the population, clearly cause damage to a substantial percentage of that population when you can individualize the people that you think are need it the most. Now, another angle we took in Colorado Springs was we began our info campaign, INFO. And INFO stands for it's not fluoride only. That's because almost every city, I don't know that there's an exception, to fluoridate their water, they put in the waste product from these pesticide plants called hydrofluorosilicic acid.
Mm.
And it has, and it's documentable, arsenic, lots of other things, not in large amounts, but in trace amounts. But the bottom line is this hydrofluorosilicic acid would cost these plants money to dispose of as toxic waste. Instead, they make money selling it to cities to put into our water supply.
Mm.
Okay. So I made the proposition that city council, if you want to fluoridate and you believe fluoride is good, well, that's your decision to make. But don't use a known pollutant to achieve that end. Pay for pharmacological grade fluoride to put into our water supply. We don't need any of the other stuff that's in it if you really feel we need fluoride that badly. So back and forth, back and forth. There's lots of studies out there showing how fluoride knocks out substantial points in the IQ, how it reliably increases the incidence of cancer in number of susceptible groups. That's all because it's a toxin. Toxins cause oxidation. Oxidation causes all diseases. It's really a no-brainer. There's a culture that insists that fluoride is just like putting liquid gold into your water supply. It's just something wonderful that you can't even scientifically contest with scientifically solid data. So I hope City Council or the powers that be are willing to open their minds to science. And I don't say this sarcastically and cynically, but if their citizens are their primary concern in the health of those citizens, they shouldn't even dream of fluoridating the water with the waste product known as hydrofluorosilicic acid.
Very good.
I think it should be the onus should be on the person who wants fluoride rather than the person that wants to avoid fluoride and just wants their water supply to be as technically pure as possible. All I'm
And
saying is very few people actually review evidence, review data. If they hear one person that they respect say this is good, that's all the proof they need. And then if you're going against that proof, then you're an enemy. It's sadly really that simple.
okay.
So they even have communities. Colorado is one of them. Had such high endemic levels of fluoride in their water. The children had a syndrome called Colorado brown stain,
Mm.
and they had similar communities in Texas, and that was even a simpler name. It was called Texas teeth.
Mm.
Okay, but the thing is, and not just cosmetic. When you see these fluorosis teeth, you can see pitting, you can see breaking down of the enamel. It's doing anything but helping the health of the tooth.
Is there anything that you would like to add to that, Dr. Levy, before we say goodbye?
Uh, no, not really, except to say, and this applies to just about all the conversations we have, is don't be afraid to research for yourself, ask questions, and most importantly, stand up for your medical and your health rights, because anyone who doesn't stand up for what is theirs is going to lose it, plain and simple.
Well, thank you so much. For those of you who are interested in learning more about Dr. Levy, you can go to peakenergy.com. If you want to learn more about the Lillian McDermott Radio Show Classroom, you can go to whenyouneedafriend.com. Thank you for your time, and I hope that this has been educational. Bye.